Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. For a radio audience tuning in at WYAD 94.1 FM and WYADonline.com, we're glad that you all can be with us. Also, tuning in to our friends at iHeartRadio and Amazon Music, we're glad you all could join us as well. But this is part of our News You Can Use segment here at WYAD, and today we're talking about something that so many people deal with, and that is high blood pressure. As we're beginning a new year, a lot of people are trying to be healthier. Unfortunately, though, high blood pressure is one of those things that is a growing health epidemic. Half of Americans have high blood pressure, and 75% of them don't have it under control. Well, there is a new option that's available to help individuals struggling with their high blood pressure. And here to talk to us about it today, we're excited to welcome Dr. Bertolet to our broadcast. He's a cardiologist that's joining us from the North Mississippi Medical Center. I want to talk to him not only about what high blood pressure, hypertension is, but also about this new treatment option. Dr. Bertolet, thank you again for the time. Really do appreciate it.
Yeah, thank you for the opportunity to be here today with you.
Well, this is a big topic, and here in the South, of course, I mean, we hear so much about high blood pressure and the dangers of it. Hypertension, of course, is also what it's called. Dr. Bertolet, so let's begin there. What exactly is hypertension?
So hypertension is high blood pressure. So we all have a blood pressure. That is the circulating pressure of blood moving through our blood vessels. But sometimes that blood pressure can become too high. And we define that when it's measured at 140 millimeters of mercury or higher. So 140 or higher would be high blood pressure. And unfortunately, with that comes medical consequences. So we can see that at that higher number, you're at increased risk of a stroke, heart attack, heart failure, or kidney failure. And as you correctly pointed out, very high risk in the South.
And it's one of those things, too, as I've talked to family members, Dr. Bertolet, a lot of times things we don't think about that are dealing with our kidneys can be tied back into hypertension and high blood pressure, which is why this conversation is so important. But technology is definitely helping us out. So tell us about this new era for the treatment of high blood pressure.
Yes, the FDA recently approved a new medical procedure for the treatment of high blood pressure. This is the Medtronic Symplicity renal system, and then this is a minimally invasive procedure that can now help us lower blood pressure in people that their blood pressures can't be controlled through diet and the attempted medications.
And that's why this conversation is so important. Can you tell us more about the procedure, Dr. Bertolet, and who exactly is a great candidate for it?
Yes, so this procedure is done somewhat like a heart cath in the fact that it's a minimally invasive procedure. It's done through a small puncture in a blood vessel. We then go up to the kidney artery with a specially designed catheter. We then send radio frequency waves through the blood vessel wall, and we disrupt or calm down the nerves that are going into and out of the kidney. And when we do that, that helps us lower the blood pressure. After we do that procedure, nothing is left behind. We pull everything out. And after about 3 hours of observation, then the patient can go home. So it's an outpatient procedure. This procedure has been proven to be effective, meaning that we're seeing about a 9 millimeter of mercury reduction in blood pressure for most patients. And then it's also been determined to be very safe. So the patients that should be considered for this procedure are those that have high blood pressure that is poorly controlled through diet or an attempt at medications, or those people that are considered to be at high cardiovascular risk because of their high blood pressure, those people that are at high risk for stroke or kidney failure or heart issues.
And this is so important, and such a great conversation for us to be able to have. Dr. Bertolet, I want to ask you, in your years as a cardiologist, what has it been like for you to see personally the advancements that have been made, especially when it comes to helping individuals like things like their high blood pressure?
This is actually amazing technology and then the advancements in time. So the idea for this actually popped up 100 years ago But 100 years ago, people used to have their stomachs cut open, and then they would cut these nerves with a scalpel. And so that's where this started back in the 1930s. And now we're using modern medical technology. We're able to do this in a non-invasive fashion in less than an hour for people, and we can get these permanent beneficial effects. It's very, very safe, and this minimally invasive technique.
Well, it's such a great thing to be able to know, again, that it now has FDA approval and something that can definitely give hope to millions of patients, Dr. Bertolet, that are struggling when it comes to high blood pressure. Again, everyone, Dr. Barry Bertolet has been our guest. He's a cardiologist at the North Mississippi Medical Center, talking with us not only about, of course, the dangers of hypertension, of high blood pressure, but also this great new procedure that's available to be able to help those dealing with it. Dr. Bertolet, where can our audience go for more information?
I would steer your audience to beyondhbp.com. So HBP stands for high blood pressure, so beyondhbp.com.
And we'll make sure that we link that up for our audience. Dr. Bertolet, thank you again for the time. Really appreciate it, and for the great work that you're doing. We appreciate that as well.
Thank you very much. Thanks for the opportunity.
Do it. And we thank your audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Then let's go make today amazing. Take care.